Welcome to the topic NSAIDs for the pain pharmacology. Pain meds, they're also called as the analgesics, like opioids, which are non-sedating, and non-opioids, which is sedating and makes the vitals slow. In this video, we will talk about the non-opioids. So non-opioids include NSAIDs. They are antipyretics, means they are anti-fever. They're also anti-inflammatory. And acetaminophen is also non-opioid. It is only antipyretic, but it is not anti-inflammatory. Opioids, it makes the vitals slow, like heart, lungs, and brain. It depresses the CNS. It has no anti-inflammatory effect, and it has no antipyretic effect either. So NSAIDs, the examples of the drug names we can remember with NSAIDs as a mnemonic: N for naproxen, S for salicylic acid, aspirin, S for acetyl salicylic acid, I for ibuprofen, I for indomethacin, and instead of S, we use K, that is ketorolac. What are the indications of NSAIDs? They are antipyretic, they are used to reduce the fever, they're anti-inflammatory, and they're specially given for gout and arthritis. What is the mechanism of action? The NSAIDs, they decreases the prostaglandin response, which causes the pain. They decrease the pain and inflammation, and they decrease the platelet aggregation, especially with the aspirin. So if we talk again, NSAIDs as a mnemonic to remember few things, N from the NSAID is not good for the entire body. It means if you're taking NSAIDs, there are chances of GI bleeding. So they are bad for ulcers. They should not be given with the patients with ulcers. They are bad for lungs because they causes asthma. They are not good for the heart because they causes hypertension and they causes the heart failure. It is not good for kidney clogging because it increases the creatinine levels and the BUN levels. It is also not good for the blood clots. So it means a tip is never take two NSAIDs simultaneously because they are not good for the entire body. Next is S. S is for sticky blood clots. So it means they are bad for the patients who are having the clot history. And why? The aspirin thins the blood. A is for asthma worsening. So it should not be given for asthma patient because it leads to bronchospasms. I is for increased bleed risk. So it should be avoided with peptic ulcers as it causes the GI bleeding. It should be avoided taking empty stomach always, and it should be avoided with egg O vitamins. As we go egg O, E means vitamin E, G is ginkgo biloba, G is garlic, and O is omega-3 oils. So if you are taking NSAIDs, you should not be taking all these four things along with. D is for dysfunctional kidneys. So it should avoid the long-term use of the NSAIDs in the renal injury. They can cause the nephrotoxicity, and they should not be used ketorolac with for any patients having a kidney disease because ketorolac kills the kidneys. Then we have S. S is for the swelling heart. So it should be avoided with the patients with CHF because the CHF patients had edema or the swelling heart. And also it worsens the hypertension. Next is aspirin. If you are taking aspirin, we should monitor for T toxicity, T tinnitus, which is ringing of ears, T tachycardia, and T is for tension, which is hypotension. Contraindications of aspirin. If A is for aspirin, A is for avoid the kids because it causes the Ray's syndrome in the kids if it's taken by kids. The child with a viral infection like flu or measles, we should not be giving them aspirin, and also never give any salicylate, and also the bismuth subsalicylate like pepto-bismol is not good to give to the kids. So aspirin, no slow any vitals. It not causes any orthohypotension. No sedation is caused by it. No CNS depression is caused by it. And no suicidal risk is related with the aspirin. Next is acetaminophen, very common drug. Absence of bleeding, it does not cause the bleeding, but it is used instead of NSAIDs to decrease the bleeding risk. It is also used for peptic ulcers, for hemophilia disorder, for mild joint pain, and for the fever. A is for acetaminophen. A is for alcohol history. If a patient is taking alcohol a lot, it can cause the liver toxicity along with the acetaminophen. A is for acetaminophen, and antidote for the acetaminophen is again A, which is acetylcysteine. Thanks for watching the video.